Hi, my name is Mai, and I am a self-employed realtor. I live in Brentwood, California. My health story revolves around the fact that my husband and I both are in the mortgage and real estate industry and have been self-employed for over 4 years. We started out doing really well with a lot of money in our savings when we decided to go full-time both in the real estate market and were able to afford health care insurance. Over the time and with the crash of the market, unfortunately, we had to begin to cut back on our costs as the income dwindled drastically. Healthcare was one of the things that we thought we could do without. My husband was on a couple of prescriptions for high blood pressure as well as high cholesterol. They were very expensive. We were able to continue to get those even though we did not have the healthcare insurance for several months. Fortunately, he found some natural alternatives to help maintain his levels that were okay without the prescription drugs. And we seem to be still doing okay without the healthcare insurance until about 6 months ago when I had a scare. I was eating spicy food as I often did, but this particular night it was really bothering me so much so that I didn't actually realize at the time it was the food causing it, but I had some really, really rough chest pains, so much so that I couldn't go to sleep. And at one point, it was so gripping that I literally rolled out of bed and was crawling on the floor. My husband was afraid, so he called 911. We weren't sure if I was having a heart attack or exactly what was going on. But by the time the paramedics came, I did begin to feel a little better. They tested me with all the things they could while they were there. They said everything looked fine, but they recommended that I go to the emergency room. When I asked them why, if everything seems to test fine, they said, well, we just want to be sure. We don't have all of the tools and the equipment here to test you to make sure, and you should probably get an EKG to make sure that you did not have a heart attack. I told them I did not have health care insurance at the time, and they said, well, they can't refuse you, but we really think that you should go. I said, I think it was really just bad indigestion. I feel better now. And they said, well, you know how many times we've heard that? And then people end up not making it because they have a heart attack. So, of course, that scared my husband and I both. And we said, okay, well, we'd go. I asked if my husband could come along. They said he could follow us in the car. Why neither of us thought that he could just drive me in the car, is beyond me. But we didn't. And, of course, they didn't recommend that. And so I get to the hospital, and they did not think that it was that much of an emergency because I sat there for 4 hours before they did anything. And eventually they tested me. The test came back okay. Everything was perfect. And I got a bill from the ambulatory service for about, it was approximately $4,000. Separate bill for the test that they ran, another couple of $1,000s, and a separate bill for the doctor that actually finally saw me after sitting there for about 6 hours. So as a result of having a bad case of indigestion and 6 hours and no health care insurance, we are extremely in debt of about $7,000 over this night.